Prince Harry and his bride-to-be are said to be considering an African adventure to celebrate their nuptials, which will take place at St. George's Chapel in Windsor Castle on May 19th. And if that's the destination of choice, they will have to wait at least 3 months until they try for a royal cousin for Prince George, Princess Charlotte, and newborn Prince Louis. Botswana, where they first holidayed together and where Harry sourced the giant diamond for Meghan's engagement ring, has been tipped as one possible location. While other experts say the £500 night Mapula Lodge in Namibia is on the wish list. So what's that got to do with Meghan carrying a royal bun in the oven? Malaria, that's what. Both countries carry a high risk of the mosquito-borne infection, which experts say increases a mum-to-be's chance of miscarriage. And the anti-malaria drugs Meghan will likely have to take can also pose a risk to an unborn baby. So, where they decide to spend their first days as a married couple could tell the world a lot about their plans to start a family. Dr. Pat O'Brien, spokesperson for the Royal College of Obstetricians and Gynecologists, told The Sun, women traveling to a malaria risk area should avoid getting pregnant because anti-malarial medication is not 100% protective. It may be harmful to the baby if taken at the time of conception or in the first 3 months of pregnancy. If a woman thinks she may be pregnant and is worried about malaria symptoms after returning from a high-risk country, she should see a doctor immediately and inform them of her recent travels. The couple have made no secret of the fact they would love to start a family. During an interview to mark their engagement, the BBC's Mishal Hussain quizzed the couple on their baby plans. To which Prince Harry told viewers, not currently, no. Of course, one step at a time, and hopefully we will start a family in the near future. And at a recent visit to Belfast, Meghan dropped more royal baby hints, when she was spotted pointing at an array of baby goods and said, "I am sure at some point we'll need the whole lot." The World Health Organization recommends women avoid getting pregnant while they're in malaria risk areas. Anti-malarial medication doesn't work in every case, so it's best not to try for a baby until you come home, experts say. Being aware of the risks of malaria to both mother and baby is important for women either pregnant or planning a pregnancy, Dr. O'Brien said. Malaria infection carries serious risks to both mother and baby, including miscarriage, stillbirth, and premature labor, and therefore pregnant women should travel to malaria risk countries only if their trip is essential. If they must travel, it is vital that they take precautions to prevent mosquito bites. Pregnant women are more likely to get malaria because their immunity to any infection is lower. They are also more likely to experience a severe form of malaria and to develop severe complications from the infection. Prompt and effective anti-malarial treatment can reduce the risks. Plus, it is not known exactly how the drugs affect your unborn baby. There are 3 drugs recommended to travelers to prevent the infection: doxycycline, atovaquone/proguanil, and mefloquine. Mefloquine is usually recommended to pregnant women, but if you are in the first 12 weeks of pregnancy or are breastfeeding, you should speak to a specialist before taking anti-malarial medication, Royal College of Obstetricians guidelines state. And if you are trying for a baby, you need to wait a while before the anti-malarial drugs are out of your system. It takes 3 months for mefloquine to leave your system, 1 week for doxycycline and 2 weeks for atovaquone/proguanil, so make sure you wait that long before you try for a baby, and consult your doctor before trying to conceive. Malaria is spread by mosquitoes, when they bite people to feed on their blood. When the mosquitoes bite, they transfer the malarial parasites into the person's bloodstream, causing them to become ill. It can cause chills, a fever, sweating, headaches, nausea, vomiting, diarrhea, anemia, muscle pain, convulsions, and blood in the stool. The early symptoms can appear like the flu, making it difficult for doctors to diagnose at first. Malaria has a host of unpleasant symptoms which also can be brought on by a variety of other issues, sometimes causing confusion for doctors, according to the NHS. Anti-malarial drugs can help prevent the disease, but they may not work in every case. You can only get a prescription from your doctor, pharmacist or travel clinic. And you must take it exactly as directed. The most common reason people catch malaria is because they don't take their medication correctly. You need to take it for a week before you go away and for 4 weeks after you come home. So, where Harry and Meghan jet off to enjoy their honeymoon, especially if it's in Africa, will tell us a lot about their plans to add to the royal brood.